Thank you, President Norris. And with me is Sarah Cave, my partner on this project, and I'm Steve Hebner. And we'd like to just give an overview of where we're at on this project. And I would like to just highlight some of our qualifications as your consulting team, and then give a high-level project overview. And then Sarah will do a more detailed status update and highlight some of the guiding principles, goals, timeline, and then we'll turn it back over to you, President Norris, for public comment. So just to make sure that this is the same two people that are in the room. In terms of our backgrounds, Sarah and I have substantial consulting, management, and board experience. We have spent our entire professional careers working in healthcare. I with many years with Arthur Andersen and KPMG, so my background is primarily financial. Sarah with Peace Health, the major health system in the area, and then as the Associate Program Director for the University of Washington MHA program. So our backgrounds for our entire careers have been in healthcare. We currently do work in areas of governance, strategy, affiliations, working with medical staff relations, and working with healthcare operations. Because we've worked in this marketplace for so long, we have a thorough understanding of the local marketplace, the providers, the management teams, and the relationships among providers with health systems in the area here. Also, we have an understanding of how health systems work, the district hospitals, larger health systems, and I think more importantly, how the marketplace is evolving. And so as you look to affiliation and the affiliation process, I think we've been able to bring that experience with the dynamics in the marketplace. And then, as I mentioned, we've certainly been involved in a number of affiliation processes. And key to that, the last point that we have here, just excellent facilitation skills to help you work through that process. In terms of the project overview, where we are right now is really kind of at the very beginning part of phase 3. Phases 1 and 2 involved a substantial amount of effort working with the commissioners to identify the principles and goals around affiliation, and Sarah will go through and highlight those in more detail here this evening. And then we're just now in the process of drafting a final request for proposal that will go out to recipients, and that will come before the commissioners at your next meeting on June 8th for your approval. Currently in that process. After that, we'll then provide the service. We'll be working with respondents to assess the RFPs. Again, that will involve significant involvement on the part of the commissioners in evaluating the various requests for proposal. And then, hopefully, based on the responses and the outcome of that, we would move into the later phases that would involve either a letter of intent and a definitive agreement and all of the due diligence surrounding that. So we would expect that the phase 3 will continue for a number of months as we hear back from respondents and work with them, and then the processes beyond that. So the project, the elapsed time of the project will be measured in months, certainly, not rather than weeks. So. And I think with that, Sarah will give us an update and take us through some of the goals and principles.
Great, thank you, Steve. So in terms of where we are today and just a quick status update of what has been completed, our primary topic and focus for today are the guiding principles and goals of affiliation, which we worked with you all, the commissioners, to develop. They're very important as they're kind of the anchor point for the RFP and become sort of the guideposts, if you will, around which we develop the criteria to evaluate the proposals we will later receive. The second thing that we have done is identified potential affiliation structures and transaction provisions. That was important in helping to draft and develop the RFP. As Steve mentioned, we do have a solid draft at this point of the RFP, and we will be bringing that before the Board of Commissioners on June 8th for approval. And we've identified organizations to receive the RFP. So here again, items 2 through 4 are all available as public document on the website from previous meetings. But our focus of this evening is around the guiding principles and goals of affiliation, which I'll just walk through with you now. So beginning with the guiding principles, these are the principles to which the Snoqualmie Valley Hospital Board of Commissioners would adhere and would expect a potential affiliate partner to also adhere to. The first is around alignment of organizational missions. This is really the true test of compatibility between organizations. Along those same lines, compatibility of core values and organizational culture. So how would you determine if in fact a potential affiliate partner is a good fit? These are some of the ways that you do that. The third one is around relationships characterized by trust, integrity, equity, and a collaborative spirit. The next one, strong reputation and brand recognition. So one of the clear things that we've heard, and you'll see it echoed in the goals, is that the commissioners and the executive team of the hospital believe that one of the things that is required to ensure ongoing sustainability of the services this community really deserves can really be enhanced with a larger organization that carries a pretty significant brand recognition. The next is transparency and open communications. As a public hospital district, it's clear that you all value that. We have been part of that process with the recording of the meetings and making sure that all of the documents that we're working through together are available for the public to view and provide input on. Commitment to serving local community and providing access to appropriate care close to home. This one is, I think, particularly relevant for a public hospital district. Really important to ensure that ongoing level of service and that not all services are going to just be leaving the community and going to whoever might be the organization with whom you affiliate. Willingness to engage mutually in transition and integration planning. So getting to a deal is really just the easy part in some ways. What is the true test is the process of actually integrating the two organizations. And this Board of Commissioners would like to ensure that there is a mutual engagement in that process. Alignment of strategic goals. So I'm going to be reviewing with you the goals of affiliation that the commissioners have identified. We'd like to ensure that the larger organization or whatever size organization with whom you affiliate actually has some shared goals and would like to co-develop some strategic priorities for the future. Supporting seamless patient flow and development of provider referral relationships. So this has to do with if you're receiving care here locally in the community, and then it is necessary actually to leave the community for some additional services, that there's a strong enough seamless relationship between the two organizations that patients can come home to the community just as soon as possible and be cared for again locally, but that the two organizations and the providers who are offering the care are in close contact so that those services are highly coordinated. And then finally, commitment to innovation. Steve and I have had the opportunity to tour your facilities, to hear some of the really specific and wonderful things that you have done to implement some very innovative things around clinical quality, around safety, and around processes of care. And this is something that you all hold near and dear and would like to see the same of any affiliate partner. So those are the guiding principles for affiliation that the Public Hospital District 1 has identified. Moving on to the goals of affiliation. So these are the goals that the district board really hopes to achieve through an affiliation. And they include, number one, and probably the most important in terms of the things that we've heard and worked through with this Board of Commissioners, is ensuring long-term viability of health services in this community. That has several different component parts underneath it, not the least of which is ensuring that the debt obligations of the district can continue to be met, and pursuing shared services and economies of scale so that services continue to be delivered in not only a high quality but an efficient way. The second goal of affiliation we alluded to also in the guiding principles, and that is to elevate the brand presence of the organization, to hopefully bring an increased patient loyalty and community awareness of services through that elevated brand. The third, to grow outpatient service volumes and offerings. There are a number of wonderful outpatient services that you currently provide. There are a number of others that potentially you could and conceivably should be providing, and with the help of an affiliate partner, that might be possible. The fourth, to grow scope of services and strengthen clinical integration. So this goes hand in hand with that seamless patient flow component that I spoke about in the guiding principles for for affiliation. And here what we're talking about are things like bringing additional visiting specialty services to the community, perhaps being able to offer more services via telemedicine, and also leveraging a resource that you all have and a service that you provide quite well in your swing bed program. And finally, increasing community outreach and expanding local community health education offerings. Several of the commissioners are quite passionate about that, and it's something that they would like to see enhanced as part of this affiliation process. So these are the guiding principles and goals of affiliation that we will, in a few moments, turn things back over to President Norris to invite your public comment on. Before I do that, I'm just going to briefly highlight a slide that is in your hard copy here. This is the timeline for phases 1 and 2, and as Steve mentioned, we are just in the process of getting ready to wrap up the last step in phase 2. And this is really primarily for your reference to see that on June 8th is when we'll be approving the RFP and finalizing the selection criteria by which the commissioners will evaluate proposals. So that's where we are in the process now. Any additional detail or information, I would invite those who are interested to tune in to these board meetings and work study sessions that we've been having, and to the website and other resources where they're made available. With that, I will turn it back over to President Norris for the public comment portion of the meeting. you're interested in public, has anybody signed up to be sign up for this? Okay. I would like to read the list according to
Did you say you wanted the list?
Is there anybody else that wants to put their name on the list? That hasn't? I'm going to ask one more time. Is there anybody else that wants to put their name on the list? All right, at this point, I have one person, Scott Scowcroft. And you're there.
Thank you. My name is Scott Scowcroft, and I live in West Seattle.
Scott, just 1 minute. Is Tony already? 3 minutes.
My name is Scott Scowcroft, and I live in West Seattle. For those who don't know me, I'm a former executive director of the Hospital Foundation, former hospital staff person, and a grateful family member of a former patient. I also have attended and videotaped most of the Board of Commissioner meetings for the last 6 years, and most recently launched and hosted the SVH Forum, a website whose slogan is "Become informed, get involved, and participate." My sense is that for the most part, what is the most of interest to the board is that the district doesn't someday default on its debt and thereby saddle taxpayers with a $50 or $100 million bill to pay off. Beyond that, the rest is more or less gravy. I think it's a given that anyone responding to the RF likely already has the operational wherewithal to be able to run a hospital and clinic. The change of perspective I'd encourage the board to adopt is to assume the same is true in terms of debt management. In other words, being able to handle the finances, including the debt, is the price of admission. If you can't do that, then don't bother to apply. The competition then becomes for the middle tier priorities. What else can you do for us? This is where I'd say being courageous and entrepreneurial comes in. Be courageous by incorporating the district's vision into the RFP that the Snoqualmie Valley becomes the healthiest community in the nation. And then entrepreneurial by suggesting steps RFP respondents can consider in order to achieve this vision. Meet this or beat it. 3 ideas immediately come to mind. Using a combination of lease and tax funds, the new hospital district underwrites public health grants to local nonprofit organizations, just like the Verdant Health does with their affiliation with Swedish. Or how about launching a school-based health program, just like Group Health does with the Seattle schools? Or maybe support a public health community services cooperative, just like the Together Center does in Redmond. If King County rezones the property, the East Campus would be an ideal place for that. Better yet, why not ask the Encompasses and the Carnation Senior Centers and the Snoqualmie Community Networks of the world to come up with their own suggested ideas and have them participate? The point is, do not undersell yourself and aim high.
Thank you. Are there any other public comments? Hearing none, we'll move on. Is there another public? Oh, yes,
I haven't signed that, but
come on forward.
I'll sign.
Just say your name and it's okay.
I'm Robert James, a citizen in Snoqualmie. I use your hospital. You used the word affiliation. I guess we're all supposed to know what affiliation means. So I'm curious, as really sort of I'm asking a question. I'm not expecting someone to answer this, but when you're talking about an affiliation, I'm curious as to whether organizations can meet much of your criteria here, and one candidate for you will be really more of an acquisition, while the others will be more of an affiliation, which maybe you have in mind. So I'm curious as to how close this comes to being an acquisition. And the other point is, are there hospital organizations in this area whose name we all know, who have relationships like this, who have hospitals like our unique hospital? And is that part of the criteria, that you've done this before and you know what you're doing? We say to them, and that would certainly be a healthy criteria. So those are sort of observations and questions, and that's fine.
Thank you.
Bob, I don't think you're alone in those questions. I think even the board is real concerned about those questions. Thank you. Are there any other public comments?
Point of order.
Yes.
I suggest to the chairperson to allow any public comment via our website or as soon as possible. If you're afraid to get up and talk to us, please do so. We want input as much as possible, and we as a board have really strive to try and be together to try and come up with goals and principles. But as you know, anything could potentially happen. And so we kind of have to rest on what we feel the community wants us to do and not us personally. So please comment if you can.
Commissioner Howard, do you want to make a statement?
Well, I'd just like to second that notion. Normally, when there's a public hearing, there's an opportunity for written comment to be received.
Yes.
The problem is we're working on a very tight schedule, and so we can't wait 30 days for public comments to come in. We need to have them right away. Maybe the superintendent would like to give us an idea of the time framework in which such comments could be considered.
We'd love to get those comments in by end of day Thursday. The reason for that is because we'd like to be able to provide you, the board, with an RFP that is actionable for the June 8th meeting. And of course, we'd like to have your packet mailed to you a week in advance. So we're really trying to get our RFP shored up by end of day Thursday.
This coming Thursday, and that date is June 1st. Thank you. June 1st.
Commissioner Howard, do you have any comments or anything you want to offer?
No, I second Commissioner Fowler and Commissioner Stephan's statement.
The only comment I have is, when we say community, we talk district. Our district goes to the pass, it goes to Carnation where I live. So we need to think about that a lot.
Also, I want to say that when the questions come up about affiliation, there are a lot of different affiliations out there. They don't all look identical. So for us, we don't know yet what's going to work for us. We're still working out what we think is best, and we haven't seen any offers because we don't have the RFP done. So this is an opportunity, and if you go home to your community, to your neighbors, and say, if you have any thoughts about this, please send a note to the hospital district, because we really do want to hear what the community